प्रोग्राम का जिहड़ा पहला हिस्सा है ਉਹ ਅਸੀਂ ਕਵਰ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਹੈ। ਇੱਕ ਇਨਫੋਰਮੇਸ਼ਨ ਮੀਟਿੰਗ, ਕਮਿਊਨਿਟੀ ਇਨਫੋਰਮੇਸ਼ਨ ਮੀਟਿੰਗ ਦਾ ਸੱਦਾ ਦਿੱਤਾ ਵਿਲੀਅਮ ਔਸਲਰ ਹੈਲਥ ਸਿਸਟਮ ਨੇ 1 ਫੈਬਰੂਰੀ ਨੂੰ। ਉਹ ਐਟੋਬੀਕੋਕ ਜਨਰਲ ਹਸਪੀਟਲ ਦੀ ਇੰਪਰੂਵਮੈਂਟ ਔਰ ਐਕਸਪੈਂਸ਼ਨ ਦੇ ਬਾਰੇ 'ਚ ਸੀ। ਪਹਿਲੀ ਗੱਲ ਤਾਂ ਇਹ ਅਸੀਂ ਜ਼ਰੂਰ ਇੱਥੇ ਕਹਿਣਾ ਚਾਹਾਂਗੇ ਕਿ ਉੱਥੇ ਕਾਫੀ ਤਾਦਾਦ 'ਚ ਸਾਡੀ ਕਮਿਊਨਿਟੀ ਨੇ ਵੀ ਹਿੱਸਾ ਲਿਆ, ਹੋਰ ਕਮਿਊਨਿਟੀਆਂ ਵੀ ਸਨ, ਲੇਕਿਨ ਇਹੋ ਜਿਹੀਆਂ ਜਿਹੜੀਆਂ ਪਬਲਿਕ ਮੀਟਿੰਗਸ ਹੁੰਦੀਆਂ ਨੇ ਇਹਨਾਂ ਦੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਤੁਸੀਂ ਇਹਨਾਂ ਦੀ ਵੈਬਸਾਈਟ ਜਾਂ ਇਹੋ ਜਿਹੀ ਇੰਸਟੀਚਿਊਟਸ ਦੇ ਬਾਰੇ 'ਚ ਪਤਾ ਕਰਿਆ ਕਰੋ। ਪਬਲਿਕ ਮੀਟਿੰਗਸ ਆਮ ਜਨਤਾ ਦਾ ਅਟੈਂਡ ਕਰਨਾ ਬਹੁਤ ਜ਼ਰੂਰੀ ਫਰਜ਼ ਆ। ਤਦ ਹੀ ਤੁਹਾਡੀ ਕੋਈ ਸੇ ਹੋਊਗੀ ਕਿ ਤੁਸੀਂ ਦੱਸ ਸਕੋਗੇ ਕਿ ਯੂ ਡੋਂਟ ਐਗਰੀ ਵਿਦ ਇਟ ਔਰ ਯੂ ਐਗਰੀ ਵਿਦ ਇਟ। ਇਹ ਸੈਗਮੈਂਟ ਦੇਖੋ। ਆਈ ਹੋਪ ਯੂ ਇੰਜੋਏ ਇਟ। ਕੋਈ ਵੀ ਕੁਐਸਚਨਸ ਹੋਣ ਇਸ ਸਿਲਸਿਲੇ 'ਚ ਤੁਸੀਂ ਸਾਨੂੰ ਈਮੇਲ ਕਰ ਸਕਦੇ ਹੋ। ਅਸੀਂ ਤੁਹਾਨੂੰ ਪ੍ਰੋਪਰ ਅਥਾਰਟੀਜ਼ ਨਾਲ ਡਾਇਰੈਕਟ ਕਰਾਂਗੇ। Thank you.
Not only did she serve on the board there, she was the international chair, but Anne could give lessons to people on how to go about fundraising.
But I would be remiss if I did not acknowledge the William Osler vision, which is to design a health system that serves the global community driven by diversity. And why I say that is that today is February 1st. It is the start of 28 days of the recognition of Black History Month.
Our next speaker this evening is Nat Anderson, and he's going to talk about the vision for Etobicoke General. So Nat?
Thanks, Jane. Always easy following Kay. You know, I said to Kay, I love her as a board chair, but I just wish she'd have a little more passion. So thank you very much. Thanks for the opportunity, and as Kay said, thank you so much for the opportunity to come and speak with all of you this evening. I just want to make a few comments about William Osler in general and Etobicoke General and where we're going with that before Anne Randall talks about what we're doing with the physical plant. Kay mentioned our vision statement to design health systems that serve the global community driven by diversity. If you were wondering what that means, all you had to do was listen to Kay's impassioned talk here. We're obviously very, very focused on all the elements that Kay has spoken about. They are fabulous folks. They are also are welcoming of a recommitment to the Etobicoke General Hospital. They're keen to see that, and we're very lucky and proud to have them working in our facility. So with that, I think I'll turn it over to Anne to talk a little bit about where we're going with our physical redevelopment of the site. Thank you.
66,000 people today going through the emergency room that's built for about 35,000. It's tight. And again, I've spent a number of hours now in the emergency room, and I'm amazed at how well the nurses actually operate in that space.
And my question is, what are you going to do specifically about the high risk of heart disease, the increased risk of diabetes in our diverse community?
I think what I'm going to do is put our chief of staff on the spot. He's standing at the back there. I'm not sure how he got to stand at the back and we all sit up at the front.
How we're going to approach this is actually a system approach, so it's not an Etobicoke specific approach, it's an approach across the LHIN. We've actually been having some conversations with some of our community partners about a possible research institute for new Canadians. It's a place we'd like to go. It wouldn't be specific to Brampton or Etobicoke, it would be for the entire LHIN. We know that, for instance, South Asians have a different set of risk factors than white Anglo-Saxons, and so we need to address some of those risk factors. A lot of it's going to be on the preventative side, so if you looked at that original graph that Matt showed, it would be on the left-hand side. That's working with our family practice partners, but providing them with the support they need to do that.
Department, like some days they are okay, but some days in holidays or like sometimes there are more rush in emergency, more than 40, 50 people waiting for that. Do you have any policy in place in case there are more people waiting and you can call more doctors?
Yes. Oh, absolutely. We definitely have a protocol for if we hit a certain capacity, do we need to bring in more physicians. It is rare, and again, Dr. Smith, if I've got anything wrong or you want to add anything, go ahead. At Etobicoke, actually our challenges are rarely about being able to get access to doctors or get access to nurses. Our challenges tend to be more about our physical plant, about being able to get, in particular, one of the challenges we have at Etobicoke right now is getting people into isolation rooms so that we can get them out of the ER and get other people through. So we don't really have any challenges getting physician coverage or nursing coverage. It's more about the physical plant in the emergency room. You're absolutely right as well. I just take the opportunity on the comment about the holidays. That's also a particularly busy time for us. At Etobicoke General on Boxing Day, we saw over 250 people on that day in a 24-hour period, which is a huge number. Typically, we would see more like 170 or 180 people. And one of our challenges is working with all of our other partners to move people out of our inpatient beds who don't need to be there, going back to this gentleman's question earlier, so we can get people up onto the floors. And on Boxing Day, our emergency room's open, but not everybody else is, and that can be a challenge for us for sure. So thanks for your question.
That system, it's Toronto's Mr. Ford putting any money into it? It hasn't committed anything?
Well, at the moment, the City of Toronto, as a policy, does not put money forward for the local share of a building.